everyone, and welcome to another episode of Melda Physio on Art Television. I just wanted to say thank you so much for all the response that I've had, for the episodes that we've done, and also just the feedback has been really great. And I really hope that all the episodes and all the topics that we've covered has really been helpful. The goal is really to get talking about certain topics, kind of get refreshed with certain things, get the information out there, because knowledge is everything. And I know my patients really value when I explain things to them, and that's really what I wanted to do with you as well. So I really hope that the topics that I'm covering really helps you all, or your families, or you can talk with your friends about it. Now let's get into today's episode, where we're gonna tackle a really big issue, actually a really common issue as well in our society. So you know someone who's had it, or maybe you've had something like a pain, a burning sharp pain that runs from your back down your leg, and that's what we call sciatica. Sciatica is a very common issue, and very now kind of people are more afraid of this term, like the same like whiplash, whoa, whiplash, like that, the same thing, sciatica. People are like, oh my gosh, you have sciatica, like it's the end of the world. But don't worry, you're not alone, and there are definitely things you can do about it, and ways to manage it. So on today's episode, I'll break down the causes, clear up common misconceptions, and show you simple exercises you can do to rehabilitate your injury and control and take care of your sciatic pain. So let's get started. Sciatica may feel like a bad leg cramp with pain that's sharp, or sometimes can be like electrical. That's because a nerve is contributing to this issue, the sciatic nerve. So the cramps can last for weeks sometimes. Definitely the sciatic pains can last weeks to months before it goes away. And the pain especially is there when you bend down, so flexion, or if there's a twist or coughing or sneezing. So that is very common kind of common symptoms of sciatic pain. Sciatica refers to the pain or a radiation of nerve pain down the leg, so either on one side or on both sides. But the thing, what you have to remember is, and a common mistake is to refer to lower back pain as sciatic pain. Not all lower back pain is sciatic pain. The sciatic pain is only if the sciatic nerve is damaged, or there's a compression and irritation to this nerve. So I'll talk about what this nerve does and where it is and how big it is and things like that in detail. But so many people say, oh, I have a back pain, that's sciatica. But it's not always the case. So that's really important and commonly mistaken. And every time people refer to sciatica, people freak out. Everybody gets so scared of this term. But it is about understanding and really diagnosing whether this issue you're having is actually a sciatic pain or not. So the sciatic nerve or nerve root, and I'll show you on my skeleton. So it's from L5 going into S1, S2. So these are the nerves that come out from the spinal, big spinal nerve, coming in together, nerve root, to form the sciatic nerve. And that nerve is quite thick. It's 2 centimeters in diameter, going from the lower back down the leg. And it's probably one of the biggest nerves that you can have in your body. So of course, if there's any issue that happens to this nerve, like if it gets compressed or irritated anywhere along the pathway, yep, you're gonna feel it. And nerves are electric wires. It connects and they give the impulses that make our muscles do things. So these are the roots that give the messages that we get from our brain or from our spinal canal. It gives the messages into the muscles to walk, to bend, to do things. So this is a big, big nerve. You don't want to get that guy irritated. So when you do, you really feel it. And it's also what you need to remember before we go further into the sciatic nerves, when they get irritated or injured, it takes time to heal. So because they are very sensitive and there are electrical parts in our system that conduct and connect things, when it gets injured, it is quite painful and it does take time to heal. So knowing this is really important, because then when you're healing, you'll know exactly the time frame, you'll know exactly why, and you know exactly how the structure rehabilitates as well. So the sciatic nerve basically goes down and activates the hamstring, and the adductors as well, the lower extremities, also into the calf and some of the foot as well. So it plays a big role in activating the function of these muscles too. So like I said, anywhere along the pathway of the sciatic nerve, if there's any compression or irritation to this nerve, that's what we call sciatica. Sciatic nerve injury is usually when the nerve itself gets damaged. So the other one is where it gets irritated, but the damage to the actual nerve can happen through trauma. So in any accident that you have, where the nerve itself gets damaged, that's the sciatic nerve injury. And so that is another kind of injury to the sciatic nerve. But commonly what you see in society is sciatica. So that is, and then we'll go into the causes of that as well. So some of the causes of sciatica could be from the spine itself. So spinal stenosis is one thing. You have like degenerative bone disorders. Spondylolisthesis is another issue that can cause a sciatica. Now my friend over here, he has a herniated bulging disc here. I don't know if you can see this, but this guy has a bulging disc. So the nerve that comes out from here is going to get a compression. There's less space. So the nerve will get irritated, and then it can cause radiating pain down the leg, for example. So the herniated or bulging disc, the issue with those are there's just less space, so there can be compression onto that nerve and then causing that radiation down the leg as well. So there are spinal causes, like I said, from the spine itself, and then you have also, like if you have in the spine, for example, a mass as well, like a tumor or some other mass, then that can also cause compression on the nerve. There are non-spinal issues that can cause sciatica. For example, the piriformis syndrome, that's in the glute area, where that muscle can cause compression onto the nerve. You get also in pregnancies, you get kind of sciatica developing as well, and lumbar radiculopathy, you get that as well. Pelvic tumors can cause sciatica too, as well as trauma to the leg. So those are non-spinal causes. You get otherwise, let's say surgery, like if you've done a surgery, through surgical trauma, you can get sciatica. Like if they've put you in a different position during surgery, you can also have a compression onto the nerve for long periods of time, which can cause irritations too. So there are different causes. It's not always just a clear-cut thing. That's why it's really important to get a good diagnosis, like a doctor or a physio, to really do the tests so that you can check. Usually in the lifetime, you'll have it like 10 to 40% of incidence of that happening. Usually we don't see a difference between men and women in terms of sciatic pain. Definitely as we age, you can see more incidents occur, maybe because of over time, depending on what kind of load you've had on your spine, or any bone spurs that may happen, calcifications that can then cause compression to this nerve. Rarely you see it under 20-year-olds having sciatica, unless it's traumatic. So if they've been in an accident, then you can, but usually not. There's no difference between heights, except if you're aging as well. Sometimes with the discs getting less hydration, then you get more compression on the nerve. You also, it depends on what occupation you're doing. So if you're doing really hard labor work, or if you're a truck driver seated for hours on end driving, if you're doing things in an awkward position for long periods of time, yes, you can develop sciatica as well. Or if you have any kind of physical stress repetitively onto the spine over time, you can get that as well. Also, Also, if you have like weight gain, also if you have more weight on, the tendency is to have more sciatica, or even people who smoke, there's been an incidence with sciatica as well. So there are a few kind of things you can grab on from, like the incidences that can cause sciatica or not. But yeah, weight is definitely one. Like the less weight you have on, the less load onto the spine, or the less load onto structures, and then less irritation to that nerve. So what do you do when you think you have sciatica, or you've had this burning sensation down your leg, from your back down into your calves, and you're just like, oh no, this is really painful? You go see a doctor. You go see a physio or your GP, or you get an analysis done. That is the best way to do that, because the moment you get onto a right strategy in terms of rehabilitation, it makes life so much easier. So the history taking will be really important for a health practitioner. The initial analysis, there are some very good clinical tests that we do to assess whether the sciatic nerve has become irritated, compressed, or in any way, So we can also see where and how, and then in terms of what we find, we can do the strategies in terms of rehabilitation as well. So the special test I'm talking about is the straight leg raise test. So you'll be lying on the bed, and then you'll be raising your leg up. Usually it's a positive test if between 30 to 70 degrees of the leg being raised. If you're having that shooting pain down your leg, you have sciatica. And then you can differentiate to see, okay, where could the compression be? So you can kind of figure out, okay, if it's more kind of from the piriformis syndrome, so maybe something to do with the leg itself, or could it be coming from the lower back? You can do certain assessments clinically as well. You really have to watch out for red flags. So we call those red flags in our practice. So doctors, physios, health practitioners who have a patient with lower back pain and suspect sciatic pain, they have to really look out for red flags. That means if you're experiencing incontinence, like you can't hold your pee when you're going to the loo, yes, you have to immediately go and check, and that will be an indication for, like, you have something where the nerves at the bottom are irritated, or there's some issue there, and then you have to act very quickly. So if you're having incontinence with this lower back pain, then you immediately need to see a doctor, and so we have some really good guidelines in terms of red flags, initial analysis, clinical tests that you can do to really get you on the right rehabilitation track. Then if the pain doesn't go away after some time, so usually we say after a couple of weeks, months, you can do an imaging test. So x-rays, MRIs is the clearest one, where you can see soft tissues, and what is the structure that is irritating this nerve, what kind of inflammation, at what stage it's at. So those kind of imaging you can do as well. And then often, the doctor may put you on like medication, like anti-inflammatories or painkillers, so that you can cope with the pain. The thing is to be really aware that the body is trying to tell you something. The nerve is a very irritable structure. It's like the structure you don't want to get annoyed. But what you have to understand is, yes, you have to cope with this, but at the same time, don't dampen everything out that you don't feel anything, because you won't know where you are in your rehabilitation process. So you won't know where your healing is if you don't feel anything. So what I would say is, be aware that the pain that you're having, it's a body's way of telling you, oh, I'm injured. I need you to change positions. I need you to take a rest sometimes. I don't want you doing the same intensity. It's the body's way of telling you there's something wrong. So yes, painkillers and anti-inflammatories definitely help you cope, especially when it's very acutely inflamed. But just remember, don't take too much that you don't feel anything, so that you're kind of aware of, oh, I'm getting better. I feel it when I'm doing certain positions, but I know how to handle it. That's where the health practitioners will really help you and guide you, where you know, okay, I know I walked too much today, so I feel it the next day. I know that I did too much, so I have to lower the intensity, So we give exercises, and exercises are medicine as well, so that is also, the dosage has to be right. So the activity you do has to be dosed right to where you are in your healing process as well. So if you do too high of an activity and your load capacity is low, you will feel it. So you have to get the load and load capacity just perfect for that point in time. It won't always be like that. As you get better, your load can increase, and so will your load capacity. So that's important. So definitely medication is there to help you, and usually the doctors will put you onto a conservative program, which includes physiotherapy, exercise, ice, heat remedies, those things. So basically, invasive or conservative treatment plans, people heal 80-90% of the time. So if you have sciatica and you do non-invasive, so non-surgical treatments, most of the time, 80-90%, which is a high percentage, you will heal. It just takes time and good guidance and a good strategy as well, So nerve damage takes a long time, or nerve irritation, it takes a long time to recover, but it does recover, So you'll have a high irritation initially. I would say give it a good kind of 3 months to 6 months, depending on how irritated it has been. When a nerve gets irritated, sometimes within weeks it'll heal. But often when we feel better, we'll go back into the sport full on and then irritate the nerve, which is still healing, again and again. And then it becomes really angry. So then it takes longer, So once you know, oh yeah, I have this, give it time to heal properly, and then slowly increase the intensity of your workout, for example. The conservative treatments will be then physiotherapy, home remedies. It's important to understand sciatica really well. So coping, I think, in my opinion, is the most important part. If you understand your issue, it's half of the work done. I work very well with my patients as a team. You can't depend solely on the health practitioner. It's your attitude towards the injury as well. If you're freaking out, or everything's going to tense up, and that's not going to help the issue either. So if you know, okay, I understand this, I know why it's hurting right now, and I know what I need to be doing, I've got good guidance, I know exercises that will help me, what feels good. Your instinct is always a really good indicator as well. If you know, I'm not supposed to be doing this doesn't feel 100% good, then you talk to your health practitioner, you get on the right track. Tailor-made exercise strategies for you. And core training is really important. I keep saying this every time, but it is what it is. Core is what helps prevent, helps rehabilitate all lower back injuries and otherwise. So core, getting your posture right, changing positions is important, so those are the things. So you'll get an assessment. You'll get maybe help from medications if you're in a really inflamed state. Then you'll go to conservative methods such as home remedies, physiotherapy, manual therapy, cold, hot treatments as well, kind of letting things heal without further intervention. If it doesn't get better, then there are other things like corticosteroid injections, which help with the inflammation of the nerve at the site. And if that doesn't get better, worst comes to worst, there's surgery as well. So that is usually a very rare thing that you would go into, because like I said, 80-90% of the sciatic ailments, or the sciatic injury basically heals. So 80-90% is really good. That 10% could go into injections or then surgery, and then you rehabilitate as well. And surgery will be just to make more space as well internally, if there's bone spurs or if there's any other spondylolisthesis or other injuries that may re-irritate the nerve as well. Then there's manual therapy. In manual therapy, which is my specialty, my thing is I'm making space all around the pathway of that nerve. The nerve is the one that's annoyed. So I want the neighborhood to be super calm so that that nerve doesn't get re-irritated. So there are soft tissue techniques, manipulations, mobilization techniques, and then of course exercise, so that you not only calm down the area, but then you fortify and strengthen the area around without any irritation. So just remember, movement is the medicine for sciatica, and even the dosage of that is important. So I mentioned that before, load and load capacity. The nerve also, not only does it take time to heal and calm down, but it also has a latent response. That means you might be doing something and feeling good, but you might feel the pain afterwards. That's the tricky part. So finding the right dosage of exercise and stretches and things is very important. That's where a physio or a doctor can guide you really well to kind of get that dosage right. So you'll know, okay, if I sit for 10 minutes, I feel I'm doing fine after 10 minutes. But if I'm sitting down for 30 minutes, I feel pain. So maybe 30 minutes is too long. Maybe 10, 15 minutes, you get up, move around, so don't stay in one place for too long. Also, resting is good, but not for too long neither. So with sciatica, you just always have to be on the move. You always have to keep changing. Find positions that are comfortable, then change, so don't stay in one place for too long. Find what works. So gentle stretches and strengthening makes a difference. Posture is important. And if your symptoms persist, don't ignore them. Get the right guidance for it. And your body is designed to move. So with the right approach, you won't let the injury get worse, and sciatic pain won't kind of hold you back. So that's really important to work out. And also, don't forget, knowledge is key. I think the most important part is when you understand your sciatic pain. If you don't, Google is great, but reading sometimes too much into that can be kind of scary. So maybe talk to a physio or a doctor about it, because they will say, 80-90% of the time sciatics heal conservatively. You'll be fine. It just sometimes takes time, and if you've re-injured the nerve or re-irritated the nerve a couple of times, it might take longer. So that knowledge is important, and just keep going, just keep motivated in towards healing. So if your attitude is like, okay, I have this injury, I know what I'm doing and I'm going to get better, that will make a whole lot of difference than if you're just really worried and concerned all the time. It's important to be concerned, get the right guidance and information, get clarity, and if you're not sure, ask again. Ask 10 times until it's clear to you what's happening, because coping with this is the key. And knowing what to do is also another key. So you have a whole bunch of keys to unlock the way forwards in your sciatic rehabilitation. Okay, so we're just going to look at a few exercises that really help with sciatic pain. Of course, I think it's always best to discuss it with your physiotherapist or health practitioner in terms of tailor-making a plan for you, because everybody is different. But these are the most common kind of good exercises to do for sciatic pain. Even just staying in this position kind of decompresses the spine. So taking breaks throughout the day, if you're walking, moving around, to just lie down, keep your knees bent or a cushion underneath, that can really help just decompress. Sometimes just also keeping your legs up on a chair or on some kind of a stool, both legs like this where it's supported, that can really also help the spine to decompress. I usually also give my patients core activation in this position. So where you're engaging your pelvic floor muscles, pulling in that belly button. I like to introduce deep breathing into it as well, because as you know, the diaphragm is the top part. So you do a deep breath, and then you breathe in and then activate your pelvic floor, pull in your belly button, and out the air goes. So you breathe in, deep breath, and then you pull in your pelvic floor belly button, and out the egg goes. So in this position, you can't harm or irritate the nerve further. It's a very neutral position, and in this position, you can really do core activation as well, deep breathing, which will help with any inflammation. Then we like to go into kind of pelvic tilts. Again, you only do this if there's no pain. If there's pain, you don't do it. Ask your physio or change the exercise. But usually a nice pelvic tilt where you're tilting your hip backwards and forwards, sometimes even back to neutral. Sometimes a certain position won't work for you. Do what's comfortable. Again, if this hurts you, you ask your physio about it. Don't do anything with pain, I would say. Or if the pain is not a good pain, sometimes there are, it's painful, but it feels good and eases up the pain after. That's a good pain. That's okay. But if it hurts more, don't do it, There are light stretches you can do, such as, pulling one leg at a time to come into this position, and then you're doing deep breathing. And then you breathe out. Bring your knees closer to your chest, and you only do that again without pain, but you're stretching your glutes a little bit, your hamstrings slightly, the lower part, but without irritation, So you breathe in, deep breath, and then you breathe out and bringing your knees closer to your body like that. And then you put your leg down one at a time. As I said, the most important part about sciatic pain is then when the inflammation calms down, you engage and strengthen your core. So this is a quite a nice exercise. You can do a combination one. I'll just show you an example. So you're in this position. You can go into something we call the Sphinx. If this is comfortable for you, you drop your glutes as best as you can to your heels. Even if you can't go that much, you can stay in this position and you stay. This opens up the facet joints, gives space in your lumbar spine, opens up the space for the nerve as well. Again, if it's painful, don't do it. You ask your health practitioner. But this is usually a lovely way which you can decompress as well. So you stay here for a few seconds and then you go back into the activated position. Here also you're engaged, and we like to do a thing called Superman. So it depends at what stage you're at, This also depends. Like if you're the beginning stage of sciatica, this is not something you might do straight away. But here you're, lengthening one leg and lengthening the arm as well to engage the core, but also the cross muscles, so the abdominal obliques and the rotational aspects as well. This is a lovely one, Superman, because you're super at getting over the sciatic pain, and this is a lovely one to do as well. We also do a thing called the bear, which is a nice one. You just have to put your toes down, lift up your knees, engage your core. 1, 2, 3, 4, 5. Slowly drop back down. For example, as a break, you can go back into the Sphinx, like that. Then go back, and then you can do the bear, for example, 1, 2, 3, 4, 5, and then go back down. Okay, so guys, now that we've talked a little about sciatica and knowing that it's the sciatic nerve that is the one that's injured, not all lower back pains are sciatica, understanding that factor, but also getting the right guidance and continue your rehabilitation. Don't stop halfway, keep it going. Knowing the right where you are is very important. Listening to your body, don't let it get prolonged, don't ignore it. Get the right help. It's so easy, and there's such good guidelines in place of what to do, how to manage it. And if you're not sure, ask and ask and ask again, because you will get to your solution. You'll get out of it. You just have to keep going. And like I said, a nerve, it's a very it's a very temperamental structure, so it does take time to heal and calm down, but it does, and that's the beauty of our body. So you just keep moving, just keep going on with your rehabilitation, and then you'll see that you'll feel so much better. That's it for today, guys. I hope this was really useful for you, and I can't wait to see you guys next week right here on Art Television. Just remember, movement is life and life is movement. So let's keep moving. Bye. Okay, I've got it. Okay. That's it from me. No. Okay. 112. Okay. That's it for today, guys. Thank you so much for watching me on... No, because what happened was I didn't realize it was so ending so soon. I had gone through anyway. Okay. That's it, please. I can't do it anymore.